Today I am going to describe you the real anatomy of the vertebroplasty procedure. When we see in the fluoroscopy what is our target and in reality where we are putting the needles, if you understand this, then you will come to know that what we have to learn and what we have to feel, what we have to see and what we have to imagine. So we can see this is the pedicle of a lumbar vertebra. Pedicle can be seen only in the lateral view, not in the epi view. So this is the lateral part of the pedicle. If we can see from top, this is the, we can say, the breadth of the pedicle, this is the length of the pedicle. So in reality it's not more than, if you see, this is 1 centimeter, markings are here. So not more than a centimeter. This centimeter journey is so crucial because once you are entering into the body, then it becomes little safe. So now your trajectory will be like this. When you see the pedicle we see in AP view or oblique view, a silhouette of the pedicle means we can see the pedicle here, it is having outer cortex. In the bone, the medulla is there inside. So this outer cortex making one shadow here. And you can see how irregular this area. This is superior articular process. So articular surface is facing little posteromedially. Here is the accessory process, mammillary process. So this area is not very smooth like a round. So we have to take a first bite or purchase in this irregular area, and that bone also little osteoporotic. So then many times it slides like this way, it may go this way. So entry point is so important. So if you see the lateral surface, so that is making the lateral border of this circular pedicle, silhouette of the pedicle. And you can see this is the medial border of the pedicle. So we can see here the silhouette of the pedicle. I cannot cross the medial border of pedicle till I am entering into the posterior surface of the body. So this journey is so crucial. Once you go inside, you cannot come back. So in this area, mostly here where the transverse process and the accessory process, mammillary process are coming at this level where we are getting the entry point at the lateral pedicular line. So this irregular area, I have to take the first bite like this way, and once I take the first entry, then you will go to lateral view. Now you can see how the trajectory will be calculated because this part is collapsed. After taking this first bite, you have to change the trajectory in such a way so that your needle now has to go in between this fracture vertebra or the collapsed end plate in such a way that this needle will go in the middle part of the end plates. And simultaneously you have to take the needle more medially as far as possible so that this will come more medially till the vertebral body I will cross the medial border. So in this way you will come more medial to the body, otherwise your needle will go more laterally. Some people, they do the vertebroplasty procedure in one needle, but usually I prefer to put 2 needles. So it is good for the beginners also. Putting one needle here, putting another needle here. So in this way if you see this area, why I am showing the real bone, lumbar vertebra, mostly this is L3. So here you can see the diameter of the needle, you can see the diameter of the pedicle, maximum 1.5 time or double. So you have to adjust the needle in such a way so that your trajectory towards the fractured part of the vertebra in between the end plates, as well as towards medially till it is crossing the middle border of the pedicle. This you have to see. Get both the needles on the same line, so then to see the needles depth, we can make the C-arm little oblique, this swimmer's view kind of, so that we can see the both the needles. They will not be in the same line in the picture, but actually they are in the same line. So that's why we will take the C-arm little in the lateral view. We will take the C-arm little oblique, and you can see both the needles. What is the depth there? Okay, now. Now again, we will take the C-arm in the real position in the lateral view and we will progress the knee.